Welcome to today's video about warning signs of non Hodgkin lymphoma. Your body is sending you messages right now. Subtle whispers that something isn't right. A painless lump that appeared last month. Night sweats that leave your sheets drenched. Weight melting away without explanation. These aren't random occurrences. They're desperate warnings from your immune system under siege. Every year, over 80,000 Americans receive a non Hodgkin lymphoma diagnosis. The tragedy? Most ignored the early signs for months, dismissing them as stress, aging, or minor health hiccups. The difference between catching this cancer early and fighting an uphill battle often comes down to recognizing 12 critical symptoms that most people overlook. Welcome to our channel, dedicated to empowering you with life-saving health knowledge. If you're joining us for the first time, you've found your trusted source for essential medical insights. Hit that subscribe button and ring the notification bell, because the information we share could literally save your life or someone you love. Drop a comment telling us which country you're watching from, and let's build a global community committed to health awareness together. Today's video contains information that transforms ordinary people into health advocates for themselves and their families. By the time you finish watching, you'll possess the knowledge to detect lymphoma's earliest warnings, knowledge that could mean the difference between successful treatment and a devastating late-stage diagnosis. Please note, this video is for informational purposes only and not a substitute for medical advice. Now, let's break down the symptoms of non Hodgkin lymphoma, starting with number 1. Painless swollen lymph nodes. Your lymphatic system operates as your body's silent guardian, filtering threats and maintaining immune defenses. When this system becomes compromised, the first distress signal often appears as painless swollen lymph nodes in your neck, armpits, or groin. Unlike tender, painful swellings during infections, lymphoma-related enlargement occurs without discomfort, making it dangerously easy to ignore. These enlarged nodes feel firm and rubbery, ranging from pea-sized to larger than a golf ball. The absence of pain tricks your brain into dismissing them as harmless, yet this painless quality represents one of lymphoma's most sinister characteristics. Research from the American Cancer Society shows that approximately 80% of lymphoma patients present with this symptom, making it the most common initial warning sign. Cancerous cells multiply within these lymph nodes, causing gradual expansion that allows surrounding tissues to adapt without triggering pain receptors. This slow progression means enlargement can persist for weeks or months before patients seek medical attention. The nodes may appear individually or in clusters, sometimes becoming visible as lumps beneath the skin. Next, number 2. Mysterious weight loss. Losing 15 pounds without changing eating habits or exercise routines might initially seem like a blessing, but when weight continues disappearing despite normal or increased food intake, this seemingly positive change becomes a harbinger of something far more serious lurking within your body. Unexplained weight loss represents one of the hallmark B symptoms of non Hodgkin lymphoma, defined as losing more than 10% of body weight over 6 months without intentional changes. This occurs in approximately 30% of patients and results from cancer's voracious appetite for energy and nutrients. Malignant cells essentially hijack your body's metabolic processes, consuming resources at an alarming rate. The National Cancer Institute emphasizes that this weight loss differs dramatically from typical dieting results. The reduction happens gradually but consistently, often accompanied by loss of muscle mass and overall physical deterioration. Your body enters a catabolic state where it breaks down tissues faster than it can rebuild them, creating a dangerous spiral that weakens overall health and immune function. Next, Number 3. Fever. Fever in lymphoma presents as a mysterious phantom that appears and vanishes without explanation. Unlike sustained fever of bacterial or viral infections, lymphoma-related fever follows an unpredictable pattern, spiking suddenly before disappearing, only to return days or weeks later. This intermittent nature makes it particularly confusing and easy to dismiss. The Leukemia and Lymphoma Society research reveals that these fevers result from your immune system's response to cancer cells and the release of inflammatory molecules called cytokines. These chemical messengers trigger your hypothalamus to raise core temperature as part of the body's attempt to fight malignancy. The fever may persist for extended periods and often proves resistant to standard fever-reducing medications. Approximately 25% of lymphoma patients experience this symptom, which may be accompanied by chills, sweating, and general malaise. The fever's persistence and lack of apparent cause should prompt immediate medical evaluation, especially when occurring alongside other suspicious symptoms. Next, number 4. Night sweats. Night sweats in lymphoma represent far more than ordinary perspiration during sleep. These episodes involve profuse sweating severe enough to soak through clothing and bedding, regardless of room temperature or sleep environment. The intensity can be so overwhelming that patients describe feeling as though they've stepped out of a shower. Mayo Clinic research indicates that approximately 30% of non Hodgkin lymphoma patients experience these debilitating night sweats. The sweating results from the same inflammatory processes causing fever, with cancer cells releasing substances that disrupt normal temperature regulation. Unlike menopausal hot flashes or anxiety-related sweating, lymphoma night sweats tend to be more severe and follow cyclical patterns. These episodes often occur nightly for weeks before disappearing temporarily, then returning with renewed intensity. The disruption to sleep patterns contributes to fatigue and emotional distress, creating a cascade of symptoms that significantly impact quality of life. The severity and persistence of these night sweats distinguish them from other causes of nocturnal perspiration. Next, number 5. Fatigue. Lymphoma-related fatigue transcends normal tiredness, creating bone-deep exhaustion that penetrates every aspect of daily life. This overwhelming weariness affects up to 80% of patients and doesn't improve with rest or sleep. The fatigue often develops gradually, making it easy to attribute to stress, age, or lifestyle factors. Cleveland Clinic research demonstrates that this fatigue results from multiple mechanisms working simultaneously. Cancer cells compete aggressively with healthy cells for oxygen and nutrients, while the immune system's constant battle against malignancy drains energy reserves. The inflammatory response can also affect red blood cell production, potentially leading to anemia and further exacerbating exhaustion. Patients describe feeling as though they're moving through thick molasses, with simple tasks requiring enormous effort. Mental fatigue accompanies physical exhaustion, affecting concentration, memory, and decision-making abilities. The unpredictable nature of this symptom makes it particularly challenging to manage and recognize as a sign of serious illness. Next, number 6. Loss of appetite. The relationship with food fundamentally changes when lymphoma affects your system. This goes beyond simple lack of hunger to encompass complete aversion to foods you once enjoyed, early satiety after small portions, and sometimes nausea at the sight or smell of food. This symptom affects approximately 40% of patients and often appears early in the disease process. Cancer Research UK studies reveal that lymphoma interferes with normal appetite regulation through multiple pathways. Cancer cells release substances that disrupt hunger signals, while enlarged abdominal lymph nodes can create physical pressure on the stomach. The body's inflammatory response also affects hormones like ghrelin and leptin that control appetite and satiety. This appetite loss creates a dangerous cycle, contributing to unexplained weight loss and nutritional deficiencies that weaken the body's ability to fight disease. The psychological impact of losing interest in food can be as distressing as the physical symptoms, affecting social interactions and quality of life. Next, number 7. Abdominal pain and swelling. Abdominal involvement in lymphoma creates a constellation of symptoms that often masquerade as digestive issues. Enlarged lymph nodes, spleen, or liver within the abdominal cavity can cause persistent aching, visible swelling, and a sensation of fullness or pressure. This occurs in approximately 25% of patients and may be the first indication of internal disease progression. Research from the American Society of Hematology shows that abdominal lymphoma can manifest as various types of discomfort, from mild persistent aching to sharp, severe pain. Spleen enlargement creates a feeling of fullness in the left upper abdomen, while liver involvement may cause right-sided discomfort. The pain tends to be constant and unrelated to eating patterns or bowel movements. Visible abdominal distension may develop as organs enlarge, causing clothes to fit differently around the waist. This swelling differs from typical bloating in its persistence and progressive nature. The discomfort may interfere with sleep, particularly when lying flat, and can significantly impact daily activities. Next, number 8. Chest pain and pressure. Mediastinal lymphoma, affecting the area between the lungs, creates potentially life-threatening symptoms as enlarged nodes compress vital structures. Approximately 20% of patients experience chest pain, pressure, or breathing difficulties when disease involves this critical region. The symptoms can range from mild discomfort to medical emergencies requiring immediate intervention. American Cancer Society research indicates that mediastinal involvement can compress the trachea, major blood vessels, or heart itself. This compression creates a sensation of pressure or fullness rather than sharp pain, with patients describing feeling as though someone is sitting on their chest or wearing a tight band around their upper body. The pressure often worsens when lying flat or during physical exertion. In severe cases, superior vena cava syndrome can develop when the large vein returning blood to the heart becomes blocked, creating a medical emergency requiring immediate treatment. Next, number 9. Shortness of breath and cough. Respiratory symptoms in lymphoma develop when enlarged nodes interfere with normal breathing mechanics. Approximately 30% of patients experience shortness of breath, persistent cough, or both as disease affects the chest area. These symptoms can range from mild exercise intolerance to severe breathing difficulties at rest. Medical literature indicates that the cough associated with lymphoma is typically dry, persistent, and unresponsive to standard treatments. It may worsen at night when lying flat, as this position increases pressure on compressed airways. Some patients develop fluid accumulation around the lungs, further compromising respiratory function and creating additional breathing difficulties. The shortness of breath often begins subtly, initially noticeable only during exertion before progressing to affect daily activities. This gradual progression makes it easy to attribute to aging, poor fitness, or other benign causes, delaying recognition of its serious underlying cause. Next, number 10. Unexplained itching. Lymphoma-related itching represents one of the most maddening symptoms, creating intense, widespread pruritus without visible skin changes. This affects approximately 15% of patients and can be so severe that it interferes with sleep, work, and daily activities. The itching differs significantly from typical skin irritation in its intensity and resistance to standard treatments. Lymphoma action research reveals that this symptom results from inflammatory substances released by the immune system's response to cancer cells. These compounds make nerve endings hypersensitive, creating intense itching sensations even without visible skin problems. The itching may affect the entire body or localize to specific areas. The absence of rash or visible skin changes makes this symptom particularly challenging to diagnose. Patients often try numerous over-the-counter remedies without relief, leading to frustration and delayed medical evaluation. The itching frequently worsens at night, contributing to sleep disturbances and fatigue. Next, number 11. Frequent infections. The immune system's compromise in lymphoma leaves patients vulnerable to infections that healthy individuals would easily fight off. Approximately 25% of patients experience frequent, severe, or prolonged infections as their white blood cells lose effectiveness. These infections may be bacterial, viral, or fungal, and often prove more difficult to treat than normal. National Cancer Institute research shows that lymphoma patients may develop opportunistic infections rarely seen in healthy individuals. Common infections like colds or urinary tract infections may last longer, require antibiotic treatment, or recur frequently. The pattern of frequent illness often develops gradually, making it easy to attribute to stress or environmental factors. Even minor infections may require medical intervention or hospitalization, whereas they previously would have resolved independently. This increased susceptibility to illness represents cancer's direct assault on the body's defense mechanisms and should prompt immediate medical evaluation. Next, number 12. Easy bleeding and bruising. Bone marrow involvement in lymphoma can severely compromise blood clotting ability, leading to easy bruising and prolonged bleeding. Approximately 20% of patients experience these symptoms when cancer interferes with platelet production or function. The bleeding may manifest as large bruises from minor bumps, prolonged bleeding from cuts, or spontaneous bleeding episodes. Research published in the Journal of Clinical Oncology demonstrates that lymphoma affects bone marrow through direct invasion or immune system dysfunction. Cancer cells can crowd out normal blood-producing cells, while some lymphomas trigger immune attacks against platelets. This creates a dangerous bleeding tendency that can become life-threatening if severe. Patients may notice bruises appearing without remembered trauma, or existing bruises taking much longer to heal. Other bleeding symptoms include nosebleeds, bleeding gums, heavy menstrual periods, or small red spots on the skin called petechiae. These represent tiny areas of bleeding under the skin and indicate severe platelet deficiency. These 12 warning signs represent your body's sophisticated alarm system, alerting you to potential lymphoma development. While individual symptoms might seem insignificant, their combination or persistence demands immediate medical attention. Early recognition and prompt treatment can dramatically improve outcomes and save lives. Trust your instincts and advocate for your health. If you're experiencing multiple symptoms or any symptom persisting beyond a few weeks, consult your healthcare provider immediately. Medical professionals can order appropriate tests to confirm or exclude lymphoma, providing peace of mind or enabling early intervention. Knowledge empowers you to protect yourself and others. By understanding these warning signs, you become a guardian of health for yourself and your loved ones. Share this information widely. Your awareness could save a life. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Please like this video, share it with friends and family, and subscribe to our channel for more essential health information. Thank you for investing in your health knowledge. Your vigilance today could save a life tomorrow.